I'm Suneel Chilukuri from Houston, Texas. I'm a board-certified dermatologist, and I specialize in cosmetic dermatology. With the rapidly changing technology that we have in dermatology, cosmetic surgery, it's important to understand what we can offer our patients. It's remarkable, really, and especially in terms of melasma and hyperpigmentation. We can really change somebody's life basically by improving their quality of skin. For scars, acne scars, surgical scars, there's so much that we can do now that we were never able to do before. And jaw shaping, you know, the latest trend that's out there, everybody talks about this snatched jawline. It's fun for Instagram, but what does it really do for a person? Somebody who has micrognathia, who has a little bit of recession of the jaw, and to give that structure and that confidence. And we see it the most often, quite frankly, in both grooms and brides. As they're getting ready for a wedding, they don't want to have that side angle shot or a 45-degree shot that shows what they consider to be a weak chin. So with the technology that we have to really be abreast as physicians, as healthcare providers, to be able to offer the latest advancements that work every single time, of course. In terms of the device that we use at this particular SBS, we're continuing to evolve and push technology. We saw that Aviclear can really help with acne in a very unique mechanism. It's shrinking the sebaceous gland, the oil-producing gland. We know that we can use something like Aerolase to actually improve the erythema as well as the active acne that's there. And that short pulse Nd:YAG is going to make a big difference in terms of the overall skin health. We can also use that same device to decrease pigmentation. So you use it in a low fluence, kind of a painting type technique, we can make tremendous changes there. We saw if you do that in combination with something else, such as the pulsed wave microneedling technology, the radiofrequency microneedling technology, that's called Silfirm. You put that together, you can have long-term results with melasma. And then you put that on top of, or you put on top of that, the Moxie, which is 1927 thulium, you're getting that home run. So we're able to lift the skin, improve the skin quality, really give great changes for our patients. So I can't wait to have more of us share what we can do with these devices. I think it's important to understand that you can treat now all skin types. In the past, we used to say, don't use an energy-based device to treat anybody who has a skin type 4, 5, or 6. That's not what we have now. You saw with UltraClear. UltraClear is a resurfacing device that improves that what we call crinkling, especially around the eyes. You can see it around the mouth. But any skin type, from me as a skin type 4, 5 to a 6, we can treat all of those. We can improve the overall texture quality by understanding how do we properly put that amount of energy into the skin. I would love to say it's me mentoring. I think oftentimes we learn from each other. So it's really nice to see what's coming down the pipeline. And so when we get together with our colleagues and we're like, okay, this product might work well. The first time that we're getting to mentor from the US outside is going to be with Daxxify. So what is our experience in the US? Because it's the first time that it was launched in the States rather than somewhere else. So with that, we're able to share our experience, and vice versa. We saw that Redensity was put here. Overseas, that's called RHA1. And so that RHA1 are now called Redensity here in the States. What's their experience long term so we don't make the same mistakes? Same thing with Volux. When we create that jawline and we're really improving the gonial angle, we're improving the mentum, how much should we be putting in? So our international colleagues have shared that with us, and then we're sharing our experience nationally and internationally with lasers in combination with those fillers and neuromodulators. I think one of the best parts of South Beach Symposium is really having the exhibit hall. Every single vendor is not just selling you something, they're really looking to partner with you. And the best part is oftentimes it's most of the faculty members that are the quote-unquote KOLs who've done the research on that product that's sharing real life experience. So we had David Goldberg out there, we have Glennis Avalon, we had Doris Day, we have Michael Gold, all the pillars of dermatology, cosmetic dermatology, and lasers that are in those exhibit halls, just walking through, learning how to do other things, and they're so approachable to talk about what they're doing now and what their real life experience is. So I think that's the biggest, most unique portion of South Beach Symposium, is really having the interaction with your colleagues inside this exhibit hall. I don't want to share too much about the upcoming South Beach West Coast, but I'm going to tell you it's going to be remarkable. We're really going to kind of divide into categories. So if you talk about somebody who has acne, what's all the treatments that we can do that's the most current offerings that we have? Let's say rosacea, people who suffer both from erythema as well as the papular pustular rosacea, what can we offer them? So there's going to be a big blend of both medical and cosmetic dermatology. How are we using some of those devices, fillers, neuromodulators to improve scars? So it's going to be exciting. I can't wait to share with you when you get there, but One of the components I can tell you is regenerative medicine. We've seen in the last 8 years what's changed. In the last year and a half, what we can do for the face, we can do for scalp, we can do for necks is remarkable. So I hope that you'll join us in South Beach, West Coast.